Coronavirus cases are surging in the United States, and hospitals in states like Texas have begun to reach capacity again. But our northern neighbors, Canada, have managed to flatten their curves to a few hundred new cases a day.
So how did they do that? Well, former healthcare executive Wendell Potter credits its single-payer healthcare systems in part as a key to containing the pandemic there. Wendell's now the president of Medicare for All now and joins us now via Skype for more on why the single-payer system is better for coronavirus response, and I would say better in general. Great to see you, Wendell.
Good to see you, Wendell.
Good to see you. Thank you both.
So I remember back during the Democratic primary, after the pandemic had really, sort of taken effect full force in the U.S., and there was this exchange between Joe Biden and Bernie Sanders. And Biden was basically like, oh, well, these European countries, they have single payers, and they're seeing spikes in infection rates, so it must not be working so well. What is your response to that sort of line of thinking?
Well, obviously, that was very, very early in the pandemic, and Italy in particular was struggling. But since then, Italy and other European countries have gotten the coronavirus much better under control than we have. And certainly Canada has as well. And Canada, of course, has a single-payer healthcare system. And a big reason for that is because there are no barriers to get tested and to get treatment in those countries. And in Canada and most of the other countries, there is no requirement that people have to pay money when they get care of any nature, certainly in a pandemic, but generally that's the case. And that's been one of the reasons why because there are people who live there, other Medicare Canada.
Hey,
Wendell, sorry, your audio is just totally cut out. Do you have some headphones?
I do. Yeah, hold on a second.
All right.
Let's try those.
Let's try that. Yeah.
Is that better? And can you hear me?
Okay, Wendell, count to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
That sounds good.
A lot better.
Oh, good. I'm sorry about that.
No worries,
okay.
no problem. We're just gonna start again. We'll start from the introduction of you, and I'll re-ask the question.
All right.
Okay, 3, 2, 1.
Wendell is now the president of Medicare for All now and joins us now via Skype for more on why the single-payer system is better for coronavirus response, and I would say better in general. Great to see you, Wendell.
Good to see you, Wendell.
Good to see you both.
So I was thinking back to this moment at the sort of end of the Democratic primary, the last debate between Biden and Bernie, once the pandemic was in full effect here in the U.S. and around the world. And basically Biden said, look, these European countries, they've got single payer and they're seeing infection spike. So this whole system may not be so great. What is your response to that? And what have we learned since then?
Well, what Biden said was in particular about Italy, which at that time was seeing a spike in cases. But as we've looked back over the past several weeks, the countries that have a single-payer healthcare system have done considerably better than we have, and they have flattened the curve, if you will. They are having fewer deaths than we are on a per capita basis. And a big reason for that is that these countries have systems in which there are no barriers to care, no financial barriers. People are covered universally in those countries. In this country, we have a situation in which there's great discrimination against communities of color. Inordinately, people of color are uninsured, and those that have insurance are fearful of going to the ER, going to the doctor, going to the hospital, and being hit with a big copayment or out-of-pocket expense. Even though the president and Congress have said that that people will be covered at no cost, there's just not that assurance, and there is no policing of that. And we're seeing so many stories of people who are hit with big bills, and that is a big reason.
And Wendell, I mean, let's talk about this in particular. I think you pointed to Canada in that original tweet. What were they able to do with what was unique to a single-payer system that has contributed to combating coronavirus?
Much better coordination at the federal level to start with. Even though the provinces have considerable influence on the healthcare budgets, there at least was a lot more coordination among the provinces and with Ottawa. That's one big thing. And another is, once again, the the leadership of the provincial government and the national government in making sure that Canadians knew that they could get tested and not have to worry about that. In fact, it just comes naturally to Canadians. They know that from prior experience that they don't have to pay anything at the point of service. But much of it is leadership and coordination among the provinces that is possible when you have a national system like Canada does.
What do we know about what Americans are being forced to pay for testing, for coronavirus treatment, and what does the prospect look like in terms of cost for potential therapeutics and ultimately a vaccine?
Well, we're seeing stories every day. In fact, I was quoted in a story that Kaiser Health News did, just looking at the experience of people who are going to the hospital, going to the ER, going to an urgent care center to get tested, and sometimes not getting a test, and that consequently, if they're not, even if they have the symptoms, they likely will get a big bill. So it's a very much a fragmented system and a scattershot way of both testing and treating Americans. We're seeing that also we're once again likely to face a shortage of supplies in places where the coronavirus, where COVID-19 is really spiking now in the South and Southwest and some Western states. So it looks like we're, in many cases, going back to where we were just a few months ago with more of a crisis than we should have, and that other countries have been able to avoid.
Mm-hmm. And one of the biggest criticisms I'll hear about this from the right is to be like, well, single-payer health care requires rationing of care on a macro level, and that particularly in a period like right now, whenever we have limited beds and limited government resources, that it could also lead to more mass rationing of care. What's your response?
Well, they actually ration care less in Canada than we do. In fact, we ration care in this country on the ability to pay, and that's one of the big problems, one of the reasons why our pandemic or our experience with the pandemic is so much worse. I was doing some research just the other day. In fact, in my old job, I used to spread misinformation about the Canadian healthcare system. It might surprise Americans to know that Canadians visit their doctors more often than Americans do, considerably more in a year. There are more doctors per 1,000 people in Canada than there are in the U.S. So this is just a myth that, regrettably, I and my former colleagues used to spread about the Canadian healthcare system. I've spent a lot of time in Canada in recent years. They are very supportive and protective of their healthcare system, and they look at the U.S. and they wonder why in the world we put up with this fragmented system. And now we're seeing the consequences, the deadly consequences of having a system like ours.
Here's one of the things that I mean, there's a lot about our response that I have just not understood, from the economic response to the health response. And we're in the middle of a pandemic. We're seeing infections spike all over the place. We still haven't had a real conversation about healthcare in this country, even as millions of people are losing their jobs. Many of them aren't going to get those jobs back. And their health insurance, if they had it, was tied to that employer. I mean, does the public understand that this system we have is a disaster? And is there any expectation that politicians are going to move away from an employer-based system that's just been an utter disaster?
I think we will see policymakers take that up because there is this growing awareness, not just awareness, but experience that so many people now are having with this employer-based system. We've gone many years thinking that this is just fine. Let's go on with it for a while longer, if not indefinitely. There just was no real concern. But this pandemic has laid bare just the absurdity of having our health insurance tied to our jobs, with more than 40 million people losing their jobs, and many of those, millions of those, losing their health insurance, not just for them, but for their families. That's ridiculous. And I think that we will see after the next election, if it's Biden or whoever it is, there's going to be enormous pressure to do something to get us away from this employer-based system, which also, by the way, disadvantages our country's small and mid-sized employers. Most small employers have just thrown in the towel. They can no longer offer benefits because of the cost, and that just shows you also that health insurance companies they're making money, but they're not able to control healthcare costs. And so consequently, even people who have jobs increasingly have jobs that don't offer benefits.
Yeah. Well, it's always great to have your perspective, Wendell. Thank you so much for joining us.
Thanks, Wendell.
Thank you both. Have a good morning.
Next on Rising, journalist Zed Jelani. He examines why some were shocked by Professor Noam Chomsky's stance on cancel culture. That when Rising continues.